I now have the pleasure to welcome Dr. Nyensuah, Tolbert, Assistant Minister and Chair of the Incident Management System for Ebola Response of Liberia, who is joining us via video conference. Dr. Nyensuah, you have the floor.
Thank you, Mr. President. Thank you, members of the Executive Committee of the General Assembly. Thank you, Mr. David Nambaro, Tony Banbury, and we've worked together very closely with Tony. He's made several trips here to Liberia with Amir, and we are grateful to be working with them very closely. And let me bring you greetings at this time from Her Excellency, the President of the Republic of Liberia, Madam Ellen Johnson Sirleaf, for extraordinary work that she's doing here to support the country team under her leadership as the commander for the Ebola response in Liberia. And also, thanks to the United Nations family, thanks to all of the international organizations, the international community, for the effort you have made in getting Liberia to where we are in fighting the Ebola virus disease in our country. It is an incredible job since the establishment of OMIR. The U.S. government also has been supporting this effort, and we have this cooperation of global public health against Ebola in Liberia by establishing the National Ebola Operations Center, but also establishing and putting in place a national strategic plan to fight not only Ebola, but to restore our normal healthcare system in Liberia. To brief you, Mr. President and member of the General Assembly, is to inform you that our fight against the Ebola epidemic, we divided it into 3 good phases in Liberia. And to inform you, Excellencies, in the first phase, we had a straightforward goal that we set for ourselves as a country. And it was to stop and reverse the increase of the number of deaths per day in Monrovia, and this, Mr. President, has been achieved by our people fully. So the first goal of the Ebola response in Liberia has been achieved. And let me describe this. In August and beginning of September, day by day, more and more people got infected and died from the Ebola virus. Our compatriots were seen in the streets. We were picking them up by vehicles. We were picking them up. Some did not know the virus they were dealing with, and secondary infections were taking place. But by the end of September, the increase stopped. And during October, the number infected by day decreased by the day. And this was achieved, like from previous speakers, like Tony Banbury said, safe barriers were able to increase our barrier teams across the country to over 53 barriers teams to move people very quickly. Now we can move a body from any part of Liberia in less than 24 hours. Another objective is to isolate people in the Ebola treatment units. Today, as I speak, we have the capacity to deal with the situation. We have empty bed space in our treatment units, about 400 to 500 capacity of empty bed space in our treatment unit due to the decrease in the number of cases. And also to safely carry on contact tracing and all of the efforts, this has led to the lower level of the cases that we've seen, and greater community involvement, community mobilization, community engagement has played a very critical role. So that's the first stage, or the first phase of the Liberian Ebola response. Now we are in the second phase, and this phase, for me, is described as the head of the Liberian Ebola response, chairing the incident management system. This second phase is the most critical phase. The number of infected people by day is decreasing, but very slowly. So we're now leveling the number of cases. the greater decrease in the first phase that we were seeing as a country has changed, and so we're leveling up now. Since the beginning of November, there are about 20 newly infected per day in the country. That means about 150 newly infected per week and almost 500 during 3-week period. With this, for each case we identify, there are about 10 contacts that must be followed on a daily basis with rigorous support. And today we have about 5,000 contacts presently that we are following up. Most cases and most contacts are still in Monserrado County, which is Monrovia, but we have transmission at the lower level going on in almost other part of the counties with recent outbreaks in areas. There's a town in Grand Cape Mount, we call it Jenewele. There's a town called Gozon in Riverside County, and in Bapulu County, there are still cases that are going on. So that's the second phase. Now, when the Ebola cases are less frequent, it is as if the disease is hiding among the other diseases like malaria, typhoid, like other diseases, infectious diseases that we have in Liberia that people are faced with. It will be more demanding, and let me underscore this. It will be more demanding to continue to decrease the transmission. That's where we will need a lot of efforts in place to decrease the transmission and move forward very, very quickly. And what I see also as the third phase of the outbreak, which will be the final phase, Mr. Secretary, Mr. General, Mr. President, and member of the General Assembly, the third and final phase will be to continue the surveillance in Liberia and to stop the human-to-human transmission by eliminating the Ebola crisis. And this cannot be done in Liberia alone, but the entire region needs to be involved. And this is where it is needed to reprogram our activities, reprioritize our activities. Like in just yesterday, we've reprogrammed some stuff and reprioritized some activities by reducing the number of bed space of ETUs that have planned across the 15 counties to 10 to 20 beds, 50 bed space ETU that will be coming online across all of our capitals in the next 3 weeks to come with the support of the United States government to the Department of Defense in collaboration with our armed forces of Liberia. And to keep up the pressure, the international community, this is the time that you need to support Liberia very quickly and very fast. I was reiterated by tuning bandbearer and active case finding, active surveillance. We have a robust response team to move to hotspots and communities that are affected. So the international community, this is the time we really, really need the support that is needed for this infected country to have a regional and holistic approach and deal with the issue. Thank you, Mr. President.
I thank the Chair of the Incident Management System for Ebola Response of Liberia for his briefing.